that people ask a lot about, and it's will dependents be allowed to stay on their parents' plan as long as they're allowed to under the current policy?
I also believe that that's popular, having children being able to stay under a parent's plan up until age 26. It used to be 19. Then they expanded that to 23 if you're a full-time student. Then you had continuation rights if you're under a group plan. So that's now 26. I think that's going to stick. And a child can stay on a parent's plan as a legitimate dependent, an eligible dependent, to their 26th birthday. But be careful. Every carrier does that differently. Some carriers cover you till the kid turns 26. Some carriers cover you till the end of the month that they turn 26, and some carry you till the end of the year they turn 26. So again, there's no consistency with the carriers, and also the size of the company you work for plays a role in the plan design and those type of provisions. So it's a good point. I think that's going to stay. It's popular.
There's been some funny things in policy designs that are confusing, and I don't want to say misleading on camera, but let's just say confusing. People who have had acupuncture benefits, let's say, on their policy, but then in the fine print it says, well, acupuncture can only be used as an alternative to anesthesia, which I don't know that that's very popular in the United States. Does it make sense that policies are presented to, let's say, employees in large numbers in big companies, and they think that they have acupuncture benefits, or for that matter, chiropractic benefits, where it says, for example, hey, you know, this policy allows you 30 visits per calendar year, but then as soon as the care is certified or pre-authorized, they really end up saying, well, this really isn't necessary, not more than a visit or 5. It's not really 30 visits then, and this is what people believe they're paying for. That's an issue, and I'll take it personally only because when a patient comes and thinks they have coverage for care, is it my role at hello to say, hey, no, you know what? Why don't you invest in your care? Forget about the insurance. Like, that's not what they came in expecting. And secondary to that, I would say, well, you're paying a lot of money for coverage, and you don't feel really good about the benefit you're getting, and who you're going to take that out on? Me.
And me.
And you too. All right, so speak to that if you would a minute.
I'm going to go back in time. Not too long ago, plans didn't even cover preventive care. So, you know, you had to sometimes say, I'm not exactly feeling well to have it covered. Today now, preventive care under Obamacare is covered at 100%, provided there's no diagnosis on the bill. Another key point is that it's not that you went for your annual physical and it was completed and you get it covered at 100%, no deductible, no copays if it's in network. It's whether there was a diagnostic code on the invoice, so you have to be careful of that. It's not the intent, it's the result of the invoice. But now preventive care is more embraced. However, wellness, such as chiropractic, acupuncture, and other equivalent types of treatments, for some reason the insurance companies are picking on you.
Yeah.
And I can't justify it, nor would I, because I think that the service you provide is very valuable. But it's a very tough gorilla to fight. So I don't know that's ever going to change. So some cover some acupuncture for certain things, some cover chiropractic up to 30 visits. Bigger companies, there might be no limitations on chiropractic, so if you work for a big company, that might be built in. There are some plans that are self-insured, so they can actually write their own plan, and if they want acupuncture, no limits on chiropractic, they could design it in there because they're paying for claims. So there's so much variability in coverage, there's no one answer. I don't really see that changing. I think the carriers feel a little bit better when they offer freebies. So some of them offer like wellness discounts. So if you use this chiropractor, if you use this acupuncturist, you know, you'll get a certain number of visits or unlimited number of visits, and you'll pay $30 or $50. So that's kind of that comes with some plans. But to answer your question, I don't see that changing. And there are other limitations as well. They don't just pick on you.
So if a doctor's going to give the best quality care to patients, and let's think outside of chiropractic, because in reality we don't need to accept insurance in chiropractic to serve patients. It's affordable. But let's say a doctor who provides more specialty medical care and it's expensive. Where do you see it going with these types of specialists being either in networks, managed care that way, or giving people options to go out of network where doctors can really feel like they can bill what their value is?
Okay. Plans can take the shape of a couple things. Number one is a pure indemnity plan. No network, any doctor, any hospital, anywhere are pretty much dinosaurs. You don't see that anymore. Mm-hmm. So now the plans have PPOs and point of service plans. Those two give you the right to go in or out of the network. When you stay in the network, you have a higher level of benefit, less out-of-pocket exposure, no balance billing from the docs because they have a contractual agreement with the providers. Those are ideal in network. However, if you choose to use a specialist that's not in a network, you're free to, subject to probably a very high deductible with greater out-of-pocket exposure, plus the possibility that the provider may balance bill you for anything that they bill that the insurance company said is not considered reasonable. So there's some risks with going out of network, but those type of plans give you that right. That's your call. So if I needed back surgery and you got to go to a real high-level surgeon, I don't like the people in the list, I could choose in a point of service or a PPO plan to go out of network, again, knowing that it may cost me a lot of money, but at least I can do that because it would be covered at least to some extent. Typically, the highest level doctors don't participate in networks, and if they were, they are starting to pull out. Mm-hmm. The highest level, I'm talking the specialists that do brain surgery, back surgery, the higher level things. And because they want to be able to charge what they want and feel they're worth, because they went through the extra training and they have the extra experience, and the people, the results are better with certain doctors. So there's more value to their service, so they want to charge more. What I find is that some doctors, not all, everybody's going to treat their business the way, their practice the way they want. Some will accept a discount, or you could say, I want to use you, but you can't balance bill me. I'll pay my deductible, I'll pay my 20, 30% coinsurance, but don't balance bill me, accept what the insurance company considers reasonable, and a lot of them will. So I think before you use out-of-network providers, you need to engage in a discussion. So that's the way you avoid surprises. Then there's EPOs and HMOs, which is strictly in-network benefits. There's no out-of-network benefits unless it's a true emergency. Urgent care doesn't count. So if you're away out of the service area for these networks and you have a stomach ache and they treat you, and a non-network provider treats you, and it's not coded as an emergency, that's going to come completely out of your pocket. So you have to be careful with EPOs, HMOs, that you understand that. True emergencies are covered. And most of the companies use a prudent man rule. So if a prudent man would seek treatment to avoid further injury, that would be considered an emergency. And if it's not, you go to the emergency room because you have a stomach ache and they diagnose you as having gas, I'm going to have a hard time fighting that. Mm-hmm. Okay, so it's got to really be a broken bone, a profuse bleeding, injury to the eye, to the head, heart attack, something true emergency.
But you're saying if there's any doubt, as an expert, just seek treatment anyway, just to be sure.
Always seek treatment first.
Very good.
Thank you.
That good advice.
Didn't I say that?